Those of us in primary care have always felt responsible for the care of our patients, and we can tell very rich stories about those patients. But now we find ourselves responsible for not only the care of those patients, but for all the data that's required to document the care of those patients. And in a value-based model, all that data is critical for our financial success as well. The old maxim, if it wasn't documented, it wasn't done, has now become, if the data doesn't exist or we can't find it, then it wasn't done. And in the case of a diagnosis, the system doesn't even think that it exists. So we find ourselves with exponentially increasing amounts of data that we're also responsible for. And those EMRs that were supposed to help us, they're great data repositories, but they don't present the data in a way that's really helpful to us. And all those pop-ups and alerts and reminders really just contribute to a feeling of being completely overwhelmed. So we all can imagine a patient who has, say, diabetes and hypertension and hyperlipidemia. And we've all been there when struggling to find everything that's in the chart, we stumble upon a note from an ophthalmologist that talks about her diabetic retinopathy and her increasing macular edema. And then some time later, we stumble across a note from the cardiologist that informs us at her last hospitalization, she was started on a beta blocker. Both of those data points are critical not only to the care of the patient, but also to the data that reflects that patient's risk adjustment factor, or what's otherwise called an episode treatment group. That data also translates into the amount of money that's available for that patient's care. And because those risk adjustment factors add up to the population of patients that we care for, if we don't do it well, the payers can look at us and say, oh, you're just too expensive compared to other clinicians who have a similar risk profile for a similar population of patients. So it's critically important that we get this right. In value-based reimbursement models, we're judged by cost and quality. And if we don't get the data correct, and if we don't have it available to us at the point of care whenever we need it or want it most, we won't be successful. Tools like natural language processing, machine learning, artificial intelligence will help us be ready to care for our patients in that way that we always have felt responsible for their care and be financially successful at the same time.